name is Philip Kern, and I'm in the Division of Endocrinology, which is part of internal medicine. And I'm a physician, and I see patients with general endocrinology disorders. Another important role that I have here is I'm also the director of the Center for Clinical and Translational Sciences, it's abbreviated CCTS, and it's a center that is research focused on improving the quality of research, especially translational research, patient-oriented research throughout the whole campus and even throughout the whole region. Right now we have a number of providers who only see diabetes. So I still see diabetes, of course, but probably because we have other providers that only see diabetes, I probably am doing a little bit more of the other endocrine stuff, thyroid, adrenal, pituitary. But I will see people with any of those disorders. Hormone disorders usually involve the whole body, the whole being, every aspect of your life. So even if you have a thyroid problem, it's hard to focus only on the thyroid. You have to know how this hormone disorder is affecting everything that the person does. So I know I am a specialist, I'm not a primary care provider, but I still try to take into account the big picture and how the hormone disorder is affecting the person. So that involves some discussion, some talking, and I try to get to know people in the time I have when as a clinician scientist, I'm thinking of new stuff. I'm trying to, in my own research, I'm trying to come up with new discoveries and think of new ideas. And I apply this to patients as well. It's not that I do crazy experimental things, but when a patient presents to me with a problem, I don't just respond in a cookie-cutter fashion that if you have this, then we do this. I try to think outside the box when it fits with the individual patient's lifestyle or their problem. And I try to think creatively as to how I can actually help improve the person. So I think this is part of being in an academic environment. I try to do my best and try to stay up on the latest things, and I try to think outside the box if that's relevant. I think, well, I don't have one good answer for the coolest part of my job, but I will say teaching the next generation is certainly cool. When I see patients in clinic, I'm with endocrinology fellows. Now these are very well-trained people who are refining their training to be an endocrinologist, and I really enjoy teaching them and seeing the look in their eye when they get something and they learn something. A really other cool part of the job is the research, because now not everything you do works out, of course, but once in a while it does, and then you actually discover something that nobody ever knew before, and that's actually really cool.